Well, let's cross now north of our border to discuss the plight of nurses in Zimbabwe on World Nurses Day, particularly in the midst of the COVID-19 pandemic. Reports from the country say that some frontline workers have been exposed to the coronavirus infection as they came into contact with patients without adequate protective clothing in some cases. The nurses have complained of working with limited protective clothing until donations were made by development partners and private business, and individuals were availed last week. The Zimbabwe Nurses Association President Enock Dongo joins us now on the line from Zimbabwe. Thanks so much indeed for joining us. Welcome to the program.
Thank you very much.
All right, Mr. Dongo, it should be a day of celebration, the work that nurses do. But I guess this year in particular, it comes with some concern.
Yeah, thank you very much. Today marks 200 years after the birth of Nightingale, the mother of our noble nursing profession. Yes, this year's celebration is unique as it comes at a time when the world is confronted by the coronavirus, COVID-19 pandemic, with nurses, frontline assistance. It's where we were supposed to have this day celebrating, showcasing the people of Zimbabwe, but because of the COVID-19, we couldn't do that since we really needed to and maintain the social distancing. But we are thankful as an association of the nurses in Zimbabwe for deciding what they are doing as far as COVID-19 is concerned. And very extremely well. Difficult that we are operating on.
Well, tell us a little bit more about the conditions that you're working under. I know that for a while, basic protective equipment was just not available.
Yeah, the issue for PPEs, it's a global issue, and Zimbabwe is not ready. We had shortage of PPEs in our hospitals. Although government is trying their best to provide PPEs, but they are not adequate and enough in the public sector hospitals, and we find sometimes nurses having to go in without the proper PPEs.
All right, so the official figure for infections in Zimbabwe is just 36, and I've been tracking progress there. It looks as if you've only had a increase of 5 in about 2 weeks. Now, a lot of people from afar are looking at this and saying, how is that possible? Are you doing testing? Do you think that this 36 represents the size of the problem on the ground?
Yeah, just for a correction, the official figure is now 37.
37?
Yes.
Okay, so, but that's still quite low,
yes,
isn't it?
The government has recently increased the testing in most of the cities, especially Harare, Bulawayo, and other that we have. But we are not yet encourage more and more of testing so that we can really that the number not be growing.
All right. So what else would you like? I know that last year, beginning of this year, there's always this debate about the conditions of work. This is beyond PPEs now for nurses in terms of pay and allowances. Has that improved, or is that still one of the things that nurses continue to battle in Zimbabwe?
Economically, I think it's in public domain that Zimbabwe economy is not performing very well. And that one definitely it will hit on the workers' side. And we, as nurses, we are not scared. We still need and the request for more for view of remuneration for the health workers. Seeing that our soldiers in this pandemic that we have really fighting, but they are motivated because the remuneration is low, the line, and we urge the government to to
All right, and the other thing that we've seen quite often is nurses as well as doctors going on strike, often leaving patients vulnerable. Is this something that you've put on hold, particularly as you're facing the pandemic COVID-19?
Yes, we really don't. We really don't need to strike. Strike is the last option in whatever we do. We believe in negotiations with government. But sometimes will be left with no option but not to do industrial action. With the COVID-19, we have committed ourselves as workers to make sure that we provide services to the Zimbabweans. And this is a war. COVID, it's like a war that we really need all the health workers come together and make sure we are together with the government as far as the pandemic is concerned. So what we are doing is we are providing service, and we don't intend to withdraw our paper during the COVID-19. The only problem that might face is when we don't have PPEs. We cannot risk our nurses to go and patients without PPEs. So this is a matter in life. So they need to be protected from getting COVID-19.
All right. Do you have enough staff, do you think, enough nurses to manage this pandemic? I see that the government has lifted a moratorium on hiring new staff. This must be pointing to getting ready and trying to have enough people, health officials, health professionals in the hospital system as this pandemic starts to put its foot down.
I would like to thank our government. They have unfolded support, national support, or health workforce support that they have opened. And the process of recruiting is going on. That will go a long way as far as the human resources is concerned. But still, it's not enough. We still need more. With the pandemic, definitely the appetite, the requirement for human resources is now high. We really need more nurses to address to cover the gap. So we expect a government to keep on recruiting so that we can have adequate staff in our hospitals.
All right, Mr. Dongo, we're going to have to leave it there, but thanks very much indeed for joining us on this very important day for the nursing profession, the World Nurses Day. That was the president of the Zimbabwe Nurses Association, Enock Dongo, who himself is a midwife with the Ministry of Health there. He was talking to us about some of the challenges that the country is facing. And much like other parts of the world, protective equipment is one of their major concerns. And also Zimbabwe has trained its health professionals so well that many of them have travelled to other parts of the world. The UK in particular is one area that I can point to. And so resources, staff on the ground, not always enough. And he's saying that more is required, particularly in the midst of this pandemic.